we have a transverse ligament which binds the anterior horns of the lateral and medial menisci. That's all the story of intracapsular ligament. Two menisci, two cruciate ligaments. Then what are extracapsular ligaments? There is one medial collateral ligament which is also called tibial collateral ligament. What is the single most important point to remember about it? It attaches with medial meniscus. Then any injury to the medial collateral ligament will also cause a concomitant injury of the medial meniscus. Then what is the purpose of this tibial collateral ligament? What is it basically doing? The medial displacement, the tibia and femur both want to give up medially. That is prevented by this medial collateral ligament. The medial displacement of the two long bones and thus the abduction of the leg at the knee is being prevented. And it becomes very taut during extension and limits the abduction and extension of the foot, of the leg. Whenever you abduct the leg, then medially it will try to project itself. No, that is prevented by medial collateral ligament. Hence, it prevents the abduction of the leg. Okay. Now, lateral collateral ligament. Basically, lateral collateral ligament is a cord-like structure, doctor. And tendon of popliteus muscle separates the lateral meniscus from that of the lateral collateral ligament. And between the lateral femoral epicondyle until the head of the fibula, laterally. We have seen now head of the fibula will give origin to lateral collateral ligament. It extends. And of course, during extension only it will become taut and it basically limits the adduction of the leg. If you try to adduct the leg, the bone need to project laterally. That is prevented by the lateral collateral ligament is what need to be remembered. Then comes the petalar ligament. Basically, it is a fibrous band-like structure and it is a continuation of the quadriceps femoris. What is quadriceps femoris? Vastus medialis, vastus lateralis, intermedius and rectus femoris is called quadriceps. No, that extends as petalar ligament. And you can use a part of it in order to repair the anterior cruciate ligament as a surgeon tomorrow. And from the apex of the patella till the tuberosity of the tibia, it will be extending. Then there is one arcuate popliteal ligament arising from the head of the fibula. There are no special comments about it. Oblique popliteal ligament, it is important. Common question asked is, the oblique popliteal ligament fundamentally is an extension of semi-membranous tendon, and it is the one which prevents the hyperextension of the leg. Then we have a popliteus tendon which is running between lateral meniscus and lateral collateral ligament, and that's all are all the extracapsular ligaments of the knee joint. Now, a few comments on bursae. Suprapetalar bursa. Then we are having subcutaneous prepetalar bursa is one, and this is all the synovial capsule of the knee joint. Then we have one deep infrapetalar bursa. Then we have subcutaneous infrapetalar bursa. So, subcutaneous infrapetalar, subcutaneous prepetalar or subcutaneous. Whereas the deep infrapetalar is deep, not subcutaneous. So, that is what we need to basically appreciate. Okay, doc? Now, where is the suprapetalar bursa? It is deep to the quadriceps femoris muscle, and it is the main bursa communicating directly with the synovial cavity of the knee joint, very important from surgical anatomy point. Suprapetalar bursa communicates with the subcutaneous prepetalar bursa. Then how about prepetalar bursa? You have one on the superficial subcutaneous location and other one is that's all. I mean, subcutaneous location you have one. That is subcutaneous prepetalar bursa. Then we have the infrapetalar bursa. In that you have two varieties: subcutaneous infrapetalar and deep infrapetalar. Right? So subcutaneous infrapetalar bursa is typically the one which lies on petalar ligament, and deep infrapetalar bursa is deep to the petalar ligament. They are superficial and deep in relation to the petalar ligament, as all of you know very well by now. Now, doctor, if you look at the posterior aspect of the knee joint, you have some more bursae. Typically, we have what is called as anserine bursae. Then we have popliteal bursa. You have a semi-membranosus bursa. Then there is one gastrocnemius bursa. So many bursae are there in the back of our knee joint. Anserine bursa. What is the other name given for it? It is also called goose foot, fundamentally. Also called pes anserinus. Between the tibial collateral ligament, that is on the medial aspect of the posterior aspect of the knee joint, and the tendon of the sartorius gracilis and semitendinosus, we are having typically the bursae. So that's all the story about the various bursae. Then, doctor, before we say goodbye to the knee joint, unlocking and locking of the knee ka matlab kya hai? What does it mean? What happens during that is one of the important issues for the examiner. At the commencement of the flexion of an extended knee, you have extended the knee, doctor, you are trying to flex it, you have unlocking. The main aim is unlocking will enable the slackening of the cruciate ligaments. Then during unlocking, whenever we are flexing an extended knee, what will happen? The femur will rotate laterally. The femur will rotate laterally and the tibia will rotate medially, and it is the muscle popliteus which will enable the lateral rotation of the femur and the medial rotation of tibia, and that will unlock and enable the cruciate ligaments to relax and the flexion to happen of an extended knee. Okay, this is a favorite question of the examiner. Who is responsible for the unlocking? Then why will locking? What is meant by locking? Whenever the joint is in a full extension, we need to lock. So the femur and the tibia, they become like a uniform structure which will hold us stand firmly on the ground. So the menisci become compressed between the tibial and femoral condyles. The menisci, which are the shock absorbers, get compressed whenever there is a locking, and all ligaments become tightened. And what happens to femur? During locking, femur become medially rotated and on the tibia, and during unlocking, this medially rotated femur should become laterally rotated, then only lock will open. Examiner's favorite question is what happens during locking, unlocking, and which is the unlocking muscle, which is the popliteus, is what you have to clearly remember for the tomorrow's exam, doctor. Then there are few more comments. Yes. Gaikwad is correctly saying what happened to housemaid's knee. I will see how much this anatomy which we are discussing now you will remember when we reach orthopedics, right? So if your anatomy is clear, at least mental picture of anatomy is clear, orthopedics is a cakewalk, right? So any amount of extra investment of time on anatomy is worthwhile. Now, of course, I will tell the same thing for physiology, pharmacology, microbiology also, because any worthwhile investment on basic sciences is required. Now, proximal tibiofibular joint. What kind of joint it is? There are three, four more joints left over. We will run through them. Don't worry. Knee only is called complicated joint, no, because it takes a little longer time. It is a plain type synovial joint between the head of the fibula and the tibia. There is a very little gliding movement. Then distal part of the tibiofibular joint, it is a fibrous joint between tibia and fibula. Now comes the ankle. What kind of joint is ankle? Chuck your ankle like a hinge, you can move it. So Ginglivat's synovial joint, hinge type, is ankle. So who are participating in the ankle joint, doctor? You know, the tibia and fibula superiorly, talus, the keystone, inferiorly, and it permits a dorsi and a plantiflexion. Now, the ankle joint need to be remembered because of its wonderful capsule. And medially, this capsule is strengthened by the deltoid ligament. Laterally, it is by the lateral ligament, which prevents the anterior posterior slipping of the tibia and fibula on the talus. Now let us look at the medial lateral, the two ligaments of the ankle. The medial ligament, the deltoid, it in turn has got four parts. What are they? Tibio-navicular, tibiocalcaneal, anterior tibiotalar, and posterior tibiotalar. They four constitutes the deltoid ligament. From where to where it is extending? From the medial malleolus to the navicular, calcaneus and talus. It is sending the ramifications. What is the purpose of it? Over eversion of the foot is prevented by the deltoid ligament, and it also helps in maintaining the medial longitudinal arch is what you need to remember. Then what about the lateral ligaments? What are the various lateral ligaments that we are having? There is one anterior talofibular ligament between the fibula and the talus. Then there is a posterior talofibular ligament between the talus and the fibula. Then there is a cord-like calcaneofibular ligament, another important ligament. Then what is the purpose of these lateral ligaments? They prevent the inversion of foot. Common question asked is, which ligament is injured in the ankle sprain? Sprain is fundamentally an inversion injury. Hence, lateral ligaments are the ones which are typically torn whenever there is a ankle sprain is what need to be remembered. Now, doctor, let's look at the tarsal joints. We have one subtalar joint between the talus, the keystone, and the calcaneum. Between the talus and calcaneum, we have a joint which is called talocalcaneal joint. Is this between talus and calcaneum, and it is also called subtalar joint. It is a plain synovial joint and it will allow the inversion eversion. Then talocalcaneo-navicular is a ball and socket type between the head of the talus and the head of the talus, which is a ball, and socket being provided by calcaneus and navicular bones. Between the two, there is a ball and socket. Commonly asked question. Talo, calcaneo, navicular means we think in the foot, can we imagine ball and socket? Yes, sir. There is a ball and socket on which we are dangling here and there throughout our life. And the spring ligament is the one which supports talocalcaneo navicular joint. What is the spring ligament? Is also called plantar calcaneo navicular ligament is called a spring. And that plantar calcaneo navicular supports the talocalcaneo navicular joint is what I want to underscore. Then between calcaneum and cuboid anteriorly, we have a transverse tarsal joint, which is a saddle joint basically, is what need to be remembered. Then we are having one transverse tarsal, otherwise called mid-tarsal joint. And between calcaneum and cuboid, talus and navicular, if you combine the two joints, that becomes a transverse tarsal joint, and it is also needed for the inversion and eversion. So that's all the story of the various joints, doctor. Mainly for the exam, you need to remember spring ligament, deltoid ligament, then the menisci, cruciate ligaments, and the iliofemoral ligament, very strong one. So these are the things to be remembered. Before we go to the quiz, let's quickly run through the surgical anatomy so that we have a satisfaction that we are done with it. Between anterior dislocation of the hip and posterior, which is more common, doctor, posterior dislocation. Whereas in the shoulder joint, anterior dislocation is more common than posterior. And whenever posterior dislocation is there, acetabular labrum posteriorly become injured, ligamentum capitis femoris is injured, sciatic nerve which is passing behind the hip joint is injured, and the limb will go into shortening, flexion, adduction, and medial rotation is the typical posture. If it is anterior dislocated, flexion, abduction, and lateral rotation is what you get. And if it is central dislocation, then typically there is it is often associated with the injury of the various pelvic viscera if there is a central dislocation. So what is coxa valga? Angle exceeding 135 degrees. What is coxa vara? Actually less than 110. Then what is drawer sign? We have an anterior drawer sign where we try to slip the tibia forward on the femur, and that is due to the anterior cruciate ligament injury. Posterior drawer sign is sliding of the tibia on the femur posteriorly to know the posterior cruciate ligament injury. Then medial meniscus is more often injured than lateral meniscus, one of the favorite questions of the examiner. What is unhappy triad of O'Donoghue is one of the common questions in the knee joint. What is it? Whenever a football player's shoe is being stuck up in the hole in the ground, and then multiple structures in the knee joint become injured, and the knee become markedly swollen, and there is a tenderness. If you apply pressure along the tibial collateral ligament, if you apply pressure, there is a severe tenderness. And what are the three structures which are together injured in the unhappy triad of O'Donoghue? Tibial collateral ligament because of the excessive abduction, anterior cruciate ligament because of the forward displacement of the tibia, whenever the foot is being stuck with a flexion and rotation of the knee joint, and injury of the medial meniscus because of the tibial collateral ligament attachment to it. So the combination is basically called as unhappy triad of O'Donoghue. Then what is meant by genuvalgum? Tibia is bent and twisted laterally, becomes knock-knee, genuvalgum, and any collapse of the lateral compartment of the knee or a rupture of the medial collateral ligament can lead to the development of a knock-knee, which is fundamentally a genuvalgum, is what need to be remembered. Then we all elicit tendon reflection. What is the root value of that in the surgical anatomy? You should not forget L2 to L4. And sometimes we can use petalar ligament in order to repair the anterocruciate ligament, as what we have discussed. Then housemaid's knee, as proposed by Gaikwad. What is it? Prepetalar bursitis. Clergyman knee is infrapetalar bursitis. Then we can have a popliteal cyst, which is called Baker's cyst. Whenever there is any arthritis of the knee or a meniscal injury or a herniation into the joint capsule, there can be a development of a cystic development in the posterior aspect of the knee, which is called as Baker's cyst, and it basically impairs the flexion and extension of the knee joint. And whenever the knee is extended, the pain becomes worse if there is a Baker's knee posteriorly, and you can be able to drain that Baker's cyst. Then what is meant by bunion? A swelling on the medial side of the first metatarsophalangeal is called as bunion. It is also an inflammatory bursa, and usually bunion is associated with hallux valgus. What is hallux valgus? The big toe, if you take, the lateral deviation of the big toe is called as hallux valgus, and that lateral deviation will lead to bursitis on the medial aspect of the first metatarsophalangeal. Hence, bunion and hallux valgus, both of them are associated with each other. Anyway, these all things we will discuss in more detail in orthopedics.